A nonprofit government watchdog group called OpenTheBooks.com has found 3 of Nashville's biggest nonprofit hospitals have not been in total compliance with federal rules.
Right now, we are joined live by Rachel O'Brien with OpenTheBooks.com to talk more about this. And Rachel, what are the federal rules?
So this is a rule specifically about hospital pricing and transparency about that pricing. The rule requires that hospitals post on their websites a price estimator tool where patients can search for specific services and get a price estimate. Hospitals must also post a very detailed standard charges list for all items and services that they provide, and they have to include the cost under each health insurance plan. We're working with an organization called Patient Rights Advocate. They publish reports regularly where they assess hospitals all around the country to see if they're complying with this law. They found that just under 25% of hospitals were in full compliance with the price transparency rule.
So, Rachel, which hospitals are falling short in our area that you've found out here?
Yeah, we looked at Vanderbilt University Medical Center. There are 10 pricing components, and they are missing 2 of them. They have a price estimate tool. They have a standard charge file, but the file isn't complete. It doesn't adequately identify specific health insurance plans for all commercial payers. So depending on what insurance plan you have, you may not be able to see what prices are specific to your plan. We also looked at Ascension St. Thomas West and Midtown hospitals, and they're both also missing 2 out of the 10 pricing components. Again, they have a price estimate tool, they have a standard charge file, but it's not complete. It's missing rates, it's missing certain information, so there's still work to be done.
Okay, Rachel, and then of those hospitals, what did they have to say when you asked about this?
So both of the spokesperson from Ascension pointed to the fact that they do have the tools on their website, and they pointed out what a lot of hospitals are doing. The Centers for Medicare and Medicaid Services, they're in charge of monitoring this rule. They're in charge of making sure hospitals are complying, and they've only fined 2 hospitals, which are in Georgia. So a lot of hospitals are pointing to this and saying, look, we haven't been fined. We're doing a good job, even though they're not completely compliant.
So a matter of just not caught and then not, facing consequences for it. Okay, Rachel, thank you. You can read more about that investigation at Fox17.com.